So let me start with a little bit of context on why we're here. Senate Bill 245 directs the New Hampshire Insurance Department to conduct a statewide analysis of the cost of providing ground ambulance services, and RAND is running the data collection process. The goal is simple but important. We want to develop a clear data-driven picture of what it actually costs to run a ground ambulance service in New Hampshire. That information will be used to build a cost-based reimbursement framework for commercial health insurers, which is set to take effect on January 1st, 2028. The data you will provide will directly inform the payment rates that commercial insurers will be required to pay for ground ambulance services in the state. We wanted to be clear about one important point related to the data. All data submitted will be kept strictly confidential. Your organization's individual data will never be publicly reported. Results will only ever be presented in aggregate form, meaning no one will be able to identify your organization's specific costs or revenues from anything that we publish. Now let's talk a little bit about who needs to participate. All licensed transporting organizations are required to submit data. Non-transporting organizations are invited to participate, but are not required. If you have any questions about whether your organization is required to participate, please reach out to the help desk. We'll have that contact information for you at the end of the presentation. We also wanted to say and echo the comments of the commissioner, a huge thanks to all of the organizations participating in this process and all of you who are here today. This is your opportunity to make sure the rates reflect the real costs of providing ground ambulance services in the state. The more accurate and complete the data we receive, the better the resulting rates will reflect realities on the ground. Let's take a quick look at the timeline. One of the first things you'll need to determine is your reporting period. We're asking all organizations to submit data on a continuous 12-month period that ends sometime in calendar year 2025. This means you can report on calendar year 2025 or a fiscal year that starts somewhere in 2024 and ended in 2025. This flexibility is intentional. We recognize that different organizations operate on different fiscal years, and we didn't want to create an undue burden by requiring everyone to report on the same calendar year. The data submission process will occur over the summer of this year. We will then conduct data validation checks during the fall and may reach out to some organizations to verify specific pieces of information. We will then calculate the new rates in early 2027. Now let's talk about how you'll actually submit your data. Reporting will take place through a streamlined version of the Medicare ground ambulance data collection system. Many of you are already familiar with this process. We've simplified it specifically for this state-level effort to reduce the reporting burden as much as possible. One important point here, this state data collection is completely separate from the federal GADCS process. Even if your organization has already completed that reporting, you are still required to submit data for this effort. The two processes have different purposes and different reporting periods, so one does not substitute for the other. Data will be submitted through a secure online portal. The link to the portal will be sent directly to your organization's designated contact. If you're not sure who will receive the link, please check with your organization's leadership or reach out to the help desk and let us know. We know your teams are busy, and we've tried to make the template as clear and as user-friendly as possible to minimize the reporting time required. So what exactly are we asking you to report? The data collection template is a structured Excel sheet organized into 5 key areas. Organizational characteristics are basic information about your organization, such as contact information and organization type. The service volume section asks about the number of ground ambulance responses and transports and other calls for service you responded to during your reporting period. The labor cost section asks about compensation and hours for all paid staff as well as information about volunteer labor. The non-labor cost section asks about information on other major cost categories, including vehicles, facilities, equipment, supplies, vendors, and overhead. Finally, the revenue section asks about the payments you received from all types, including insurance carriers and any local tax revenue. The template also includes some built-in cross-checks. These are rows that will flag potential inconsistencies in the data that you've entered. For example, by checking that the cost totals reported in each section are as intended. And I want to be clear about these cross-checks. They are purely a quality control tool to help you catch any errors before you submit your data. They are not a reflection of how the rates will ultimately be calculated. And also, flagging a cross-check does not mean that your data is wrong. It just means it's worth a second look. Now I wanted to transition into talking through a few common issues with reporting data. One of the most common questions we receive from organizations is how to handle costs of revenues that are shared across multiple service lines. Sharing staff or facilities is common for ground ambulance organizations that are part of hospitals or fire departments. If your organization shares costs with another service line, you are expected to report costs that are partially or fully related to your ground ambulance services. You'll report these costs with an allocation factor. An allocation factor is simply a percentage of the shared costs that you attribute to your ground ambulance services. The factor you use should make logical sense for the type of cost you're allocating. For example, for labor costs, you might use the share of calls that are ground ambulance responses to total responses. We've included this level of flexibility because not all organizations may do things the same way. Here's a quick example of how to create an allocation factor. Suppose your organization rents a garage for $20,000 a year. The garage is 5,000 square feet and holds 2 ambulances and 2 fire trucks. Let's say that the ground ambulances take up about 2,000 square feet in the garage. 2,000 divided by 5,000 is about 40%. So in this case, you'd report the $20,000 rental cost for the facility with the 40% allocation factor. Another common allocation factor that we just noted was the share of ground ambulance responses to total responses. Many organizations contract with outside services for commonly provided services like billing, janitorial, IT support, or even medical direction is common for many ambulance organizations. Contracted vendor costs should be reported in the vendor section of the non-labor cost tab. This is the appropriate place for any service you purchase from an outside organization rather than staffing directly. If you use contracted labor, for example, if you contract with an agency for paramedics or EMTs, you have a bit more flexibility. You can report these costs in either the labor tab or the vendor section, whichever makes more sense for how you track those expenses internally. The most important rule here is to only report each cost once. If you're unsure of where a particular cost belongs, please ask the help desk. This slide covers 2 additional situations that we wanted to flag. If your organization is operated by a local government, for example, a town or municipality, some of your operating costs may be paid for directly by the government rather than billed to your organization. Common examples include IT services, fuel, or even vehicle maintenance provided by a central fleet department. We want to ask you to make your best effort to report these costs, even if they don't show up on your organization's own budget or financial statements. If you leave costs out that are being paid on your behalf, your reported costs will look artificially low compared to similar organizations that pay for those services directly. That could result in rates that don't fully reflect what it actually costs to operate in your community. Now, one additional note on the non-transporting organizations. If your organization responds to calls but does not transport patients, as I noted earlier, you're invited to submit data, but it is not required. If you do submit data, it will be used to help inform the cost picture for the treatment in place responses. For transporting organizations that work with non-transporting organizations, particularly those that may pay fees to the non-transporting organizations, you can report those costs in the overhead section of the template. Before we get to next steps, I wanted to make sure everyone knows where to go for help. If you have any questions about the data collection process, the template, or any other question, please reach out to the help desk, and the email address is listed here on the screen. Our team monitors this inbox regularly, and we will respond as quickly as we can. In terms of notifications, licensed organizations offering ground ambulance services were notified in March 2026 using contact information on file with the Department of Safety. If you believe your organization should have received a notification but did not, please email the help desk, and we will make sure you are connected to the right resources. If your organization no longer provides ground ambulance services, but did at some point during 2025, we'd still encourage you to report data if you're able to. Even partial year data can be helpful to the analysis. Finally, the NHID website has a dedicated page for this project. The current data collection template can be accessed there. This is also where we will be posting FAQs. We will also post the slides and recording from today's webinar and any additional resources as they become available. The web address is on your screen, and we'd encourage you to bookmark it and check back regularly as we add new materials. All right, so what happens next? Here's a quick overview of the timeline in the next few months. If you haven't already done so, we encourage you to start gathering your information now. The earlier you start, the more time you'll have to address any questions or gaps before the submission deadline. The data collection tool, as I noted, is available on NHID's website now, and you can begin to fill it in. The data collection portal will be open over the summer. We will send each organization a link where they can upload their completed data collection template. Instructions for how to upload your completed template will be included in that email. And of course, please reach out to the help desk if you have any questions at all. We're here to help make this process as smooth as possible. So that brings us to the end of our prepared remarks. We'll now open it up for questions. If you submitted a question through the chat, we'll do our best to get through as many as we can today. And if we run out of time, we'll make sure to post the answers to frequently asked questions on the NHID website. So now I'm going to hand it over to my colleague, Dan, for our first question.
We actually did not get any questions in the chat.
So okay, quiet group this morning.
Oh, okay. Oh, we just got one.
Wonderful.
Okay, so if we are a multi-state provider, are we just reporting data as it pertains to New Hampshire patients? Christine, do you want to take that one?
Yes, that's a great question. We would encourage you to report your costs for your entire organization. On the service volume tab, we've included a row for the share of transports you conduct in New Hampshire, and we'll scale the cost data reflective of the proportion of your business that is in New Hampshire. We're happy to follow up separately if you have more specific questions about operating in a multi-state situation. We also have separate questions for if you are owned or operated by a larger parent organization, which would be in a similar setup of operating in multiple states. You also can report organizational costs incurred at that parent level in those specific fields. Dan, maybe one other thing that we could do is go through some of the other common questions we have had into the mailbox.
Yeah, we can definitely do that. I think we just want to, questions about the process for submitting data. So I want to just remind everyone on the slides, we have a link to the NHID's website that has a link to the tool. And then we'll be collecting that through a secure web portal called Kiteworks. And you'll be receiving a permission link to access a secure folder where you can upload your data. And all that's done through a system that no other is able to see your data, and no specific organization's data will be available to the public nor to other organizations participating in the process. So it'll all be secured.
And I am displaying on the screen. I'm coming back to this screen with all of the help resources. Dan, we've got a great question from Kim in the chat about when do we anticipate sending out the data collection template? It is available now on the NHID website, and you can download it from there. The link is here on the right side of the screen. Mekdez, if you could add that in the chat for everyone, that would be helpful. We had another question from Brad about what's the time frame for the data to be submitted. So let me divide that into two pieces. One is the data collection period. That is a 1-year, 12-month period that your organizations determine. The main requirement is it needs to end at some point in 2025. The data collection portal itself will be available for you to upload your Excel sheet over the summer. That'll open June 1st and will be open all the way until the end of August. And you can upload your completed data collection template at any time during those 3 months.
Looks like, all right, going down the chat, then we have a question about, so how do we as a municipal fire-based ground transport account for building replacement and not paying taxes as a private ground transport provider who owns their building? I think this seems like a very unique circumstance. So it might help to email the help desk on that one. I think you could guide us through your specific circumstance, and then we can give you guidance on that. So the next question is about what the net revenue is to collect. So just confirming that the net revenue is net revenue, excluding bad debt and discounts. So we will have on the tool separate fields to collect any bad debt and discounts. I just want to confirm that's correct, Christine.
That's correct. There's a field on the revenue tab where you can report bad debt and charity care. We will add an FAQ on bad debt and charity care. It's an optional reporting item. And in general, we will defer to the definitions that the Centers for Medicare and Medicaid Services has related to both of those types of uncompensated care. We'll add that to the FAQ document as well, if anyone needs more resources on that. All right, we do have a comment about the Excel file link is indicating that the file, that there's an issue with the file. We will circle back with the NHID folks after the webinar to see if there's any issues. I have been able to download the file off the website and it opens with no issues, but we're also happy to send you a copy directly.
Okay, so scrolling down the chat a little bit more. So a couple Vermont related questions. So in Vermont, we were able to send in our report from our Medicare GADCS. Can we submit this report instead of doing a separate reporting? So as Christina mentioned during the interview, so this data collection is slightly different. What we're asking you to submit, particularly we're looking for an updated time period. This will allow us to reflect what the actual costs are that you've incurred, and that will go into our rate setting methodology. So we are asking everyone to submit a separate form here for this data collection instead of the GADCS. Next question. So we are a Vermont-based ambulance that covers 2 towns in New Hampshire, but we do not station in New Hampshire in your report. So if you are licensed in New Hampshire and providing ground ambulance transports, we still are asking all of those organizations to report. So the rates are going to apply to all ground ambulance transports that are originating in New Hampshire. So we are collecting costs from organizations, regardless of where they're based, if they're doing transports in New Hampshire.
That's right.
It looks like some people have had some luck opening the file, so that's good, but we'll continue to help anyone who's having trouble with that.
That's right. And if you're having continued trouble, please email the help desk and we'll send you a copy directly and see if that helps.
So
right, Dan, we have another question.
Oh, go ahead, Christine.
Yeah, I was going to say another good question about how do we account for ambulance replacement? We ordered a new one in 2025, but won't pay for it until we receive it. We also made CRF deposits for 2 other ambulances. The goal of this data collection effort is to capture costs that are incurred in the data reporting period. With that in mind, I think the deposits for the 2 ambulances that were incurred in 2025 would be reportable. Costs that you have not paid for yet should not be included. And Benjamin, if you have follow-up questions on that question, please email us and we're happy to help. All right. Well, while we wait to see if anyone else has a question. Oh, there we go. Christopher asked to clarify, if we put money in a SIP, do we add those funds as a cost? Can you be more specific about what the SIP entails? And there's another question on tracking bad debt. We will track it in the data collection tool. You also will be able to report all of your payer revenues and cost sharing from patients there. I think if you incurred those costs for the capital improvement period in the year of data collection, those should be reported. And if it's unclear on where to report those, please email us and we'll help you find the right spot. The main thing throughout the data collection template is that costs incurred during your data collection period are only reported once. So one common category. Oh, go ahead, Dan.
No, go ahead, Christine.
I was just going to give the example of medical direction. That is often a service that is not a full-time service or full-time employee for many ground ambulance organizations. That the amount your organization spends on medical direction should either be reported in the labor or in the contracted services or vendors section, but not both places. Okay, Dan.
Oh, so we had a question about reporting ambulance purchase costs. So we purchase one every 3 years and run three. We have no 2025 ambulance costs. So the template actually asks to report these ambulance costs in a couple ways. So the purchase costs, but also depreciation costs. So if you're not purchasing any during the data collection period, we would still ask that you report what the depreciation is on that so we can factor the cost of operating those ambulances into the rates. And then it looks like Benjamin has another comment on I think it's related to bad debts again. I don't think that shows the true cost of service if we don't show costs related to large costs related to ambulance or building costs. That may only be every 8 years or more. I think we will need to think about this one. I think it might help, Benjamin. You might want to email us at the help desk. We'd be happy to meet with you and walk through this to provide any clarity here. Christine, do you have any more additional comments?
Well, I think your point, Dan, about you are allowed to report the depreciated costs for these items. I suspect most organizations may not pay cash upfront for something like a facility. And so reporting those depreciated amounts are absolutely included in the data collection tool. But as Dan noted, we're happy to meet about your specific circumstances. Yeah, and to that point, Lisa notes that some people may be speaking to a cash basis, whereas others have an accrual basis of accounting. We did not already discuss this question, but it's a great point. There is you can report on either basis. We just would suggest that you're not mixing and matching accounting methods as you're reporting. All right, so we had another question coming in on how do we determine what labor costs are fire versus EMS? This is a common issue for all organizations with shared services. I'll go back up to those slides here. If you are an organization that shares a service line with another group, we suggest that you report your full labor costs for anyone that has some ground ambulance responsibilities with an allocation factor. And we talked about some different potential allocation factors. A common allocation factor for labor is using the ratio of ground ambulance responses to total responses in your department.
Okay, so we have another question here about contracting costs for continuing education and training of EMS providers. So the question is that reportable as a vendor? And I believe the answer to that is yes. If you're getting those through a vendor, those should be included in that section.
That's right. And it's important to include these vendor related costs, because if you don't include them, it can make your organization's costs look lower than a similarly situated organization that employs those services or provides those services in-house.
Mm-hmm. And then we have a question about whether ground ambulance responses include all calls that had a patient. So we are defining responses as when you send out a vehicle to a scene or an interfacility transport, but a response doesn't necessarily need to result in the transporting of a patient. So, for example, treatment in place.
Or there may be those calls where a ground ambulance is sent to the scene and, when they arrive, there's actually no patient there, but that would still be considered a ground ambulance response because the ground ambulance was sent out on a call.
Right. And the instrument has separate fields to collect these separately.
So technical rescue and motor vehicle calls will be a medical call. I think so if a ground ambulance is sent. I could imagine that there are some potential scenarios where a ground ambulance cannot get out to the scene in a situation, a technical rescue situation potentially, but um, that still sounds like a medical response. And Dan, this is probably a good one for the FAQ here. All right. Okay, great. We are happy to stay on. We have booked this time for the entire hour, and we're happy to stay on if folks have additional questions. I did want to remind everybody that we will take all the questions we've received today and put them into a frequently asked question document that will be posted to the NHID website.
So we have a couple more questions in the chat. So is there a section of this disposable equipment costs, such as bandages? So yes, the non-labor cost tab does include both fields for supplies and equipment, which is broken into medical and non-medical. So I think that should fall under likely the medical supplies category. And then one last question, is it okay to estimate income taxes for the year reported if not paid yet? I think that's a good question. Christiane, I'll let you handle that one.
I think the answer in that case is yes, but Dan, this is a good one for the FAQ as well.
Okay, so I think this is in response to that question. So wouldn't you just use actual taxes paid during 2025, regardless of the year? I think that is definitely one approach that could be used. I think we'll provide more clarity on this in the FAQ. I think this is raising a good question.
About the timing, yes.
Yeah. Okay, so next question. So how is the revenue and accounting for the difference between municipal funding and income? The municipal contribution keep increasing while insurance income keeps dropping. Okay.
The revenue tab has separate rows for the payer revenue, direct patient pay revenue and patient cost sharing, as well as tax revenue from any source. So you will be able to report all of those sources. And we would request that you report all of those sources. And Jeff, if you have a specific question about your specific situation, we're happy to address that. But I think it's not surprising, your point that you're raising. All right, and we have another question about the percentage column, which is the allocation factor column. The higher number means more related to EMS. So 100% equals all EMS, yes, as noted in the comment. And as you'll note, as you take a look at the data collection tool, some of the cells are grayed out because we assume those resources are 100% related to EMS. So your ground ambulances, for example, you don't need to report an allocation factor there because we know that that's 100% related to your ground ambulance services. All right, I think some folks are starting to drop off, which is great. Dan and I are happy to stay if there's any other questions folks have. Otherwise, again, I'll note that we'll post an FAQ on the NHID website that addresses all of your very helpful questions today, and also makes them available to any organizations who were not able to join today as well. And if there's any other specific questions that you think of as you start to take a look at the data collection tool, please email us at the help desk, because any commonly asked questions to the help desk will also be added to the FAQ, and we will revise that FAQ as the data collection process continues.
So we've had a couple more questions.
Yeah, go ahead, Dan.
So one's about asking about reporting checks sent directly to patient instead of provider as commercial. I think this sounds like a question about patient self-pay revenue. So in the revenue section, there's different lines for the payer as well as patient self-pay or patient cost sharing, if I'm understanding this correctly. If I'm not, please, if you could clarify in the chat, that'd be helpful. We are collecting all of that as revenue.
That's right. And the difference that we see between the patient cost sharing row and the patient self-pay row is that some patients may be billed directly because the transport wasn't covered by their insurance or they're uninsured. Any of those scenarios would count in the patient self-pay. The patient cost sharing, for those that are able to separate out that information, can be reported for any payer there. We also understand that many organizations do not separate out the patient cost sharing amounts from their payers, in which case you can report it in that revenue in with the payer row. So for example, if you don't separately collect information on patient cost sharing for commercial transports, all of that revenue can be reported in the commercial payer row. The main point is to only report revenue from each source once and not to double count anything.
Yeah, so we have a follow-up question about so Anthem sends checks directly to patients, and then the patient would pay the organization. Um, so where would that go? Um, so again, the most important thing is as long as we want it in the revenue tab, as long as it's reported once. So it probably could go under either one of those. Christine, do you have a thought? This is a unique distinction that I think we'll want to add to the fact.
Yes, I agree. It's a unique distinction. I um, agree with Dan that you can report it in either place. Do you often know if that, in that scenario, do you often know whether the patient also had some payment from the insurer? I could see a scenario where if the patient just sends you a check, you don't know which claim it's tied to necessarily. In which case, reporting that in the patient self-pay row would make sense. And as Dan noted, the main thing is to report all the revenue only once and not double count anything.
We have,
Um,
so up a little bit higher. So we have a question about how important it is to report the code line numbers. I'm assuming this is talking about the HCPCS codes for each service. I think if you're having trouble or you're unable to identify those, I think contact us the help desk. I think maybe we can walk through that circumstance. Um, I know, Christine, do you have any general guidance on this?
I think that's right.
Okay, so question about where can we get the reporting license number? Um, so that is coming from your EMS license number kept by the Department of Safety. So that's when we can double check with NHID if you're having trouble locating that, and we can help you get in contact with the people to get that number.
This is Justin from the Department of Safety. Just for clarification, are you using their actual unit license number for the report and license number?
Yes, and I apologize if that wording is a little confusing. We were thinking of the reporting unit as the license holder. And so that's why it says reporting license number.
Fair enough. So everybody should know that, and that would be in their Respond NH account. So that should be your license. I can't see who asked that question, but that would be in your Respond NH account. And I guess I would have a follow-up just for clarification. If if a licensed unit has two licenses, but for the same service, what number would they use?
I think that only occurs in one case, in which case just pick one. But please email us at the help desk if you have additional concerns. You also can just report both license numbers in that field, and then we'll know. But I think that's a pretty rare occurrence.
Yeah, there's only a small number, so you are correct. Thank you.
Okay. Thank you for their great question.
So we have another follow-up on revenue for when patients are sent checks, but if they don't pay the organization, then it's not revenue. I think that's correct. If you only don't collect the revenue, then it would not be included in the revenue tab.
You could report it under the uncompensated care line, though.
Yep.
Dan, we have another question about, we don't have specific numbers for some specific line numbers. For this question, it would be great if you could email us directly at the help desk to let us know which tab you are viewing, and we're happy to help.
Yeah, so this is related. This is again getting back to the HCPCS code. So these are the
Okay.
specific ones. And again, I think the best approach here is email us at the help desk, and we can help figure out the best approach for this.
Yeah, I think, broadly, if you don't provide a certain service, then just put 0. But yes, as we both noted, we'll check in with your specific case would be great. Thanks. I missed the section 2 part in your comment, so I apologize. I missed that. Okay. Yeah, and thank you all again for taking some time today to be here. I know you all are busy, very busy. And we're happy to provide as much support as we can at the help desk. So please email us if you run into any issues. Well, all, we might end a few minutes early to give you some time back if questions are slowing down. I'll wait one more minute here to see if anybody has any last questions, but otherwise I think we can all sign off. As I noted, we will write, take all the very helpful questions from today and draft a frequently asked questions document, which will get posted to the NHID website later today, or sorry, hopefully by next week, so that all the organizations can benefit from your fantastic questions. All right, any other final thoughts? All right, everyone. Well, I will give everybody about 10 minutes back, and I hope everyone has a wonderful week. And as I said, please email us at the help desk if you have any additional questions. Thank you all so much for being here today.